Hello, everyone. We'll get started in just a couple of minutes to allow some time for other participants to join. Good afternoon, good morning, and good evening to everyone. We welcome you all, particularly those of you joining from far away or late or early times. Thank you for joining this WHO EPIWIN webinar on the STAR experience in managing health emergencies and disasters, including climate crisis in countries. For those new to EPIWIN, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. Our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. Today, we have a great panel to discuss the WHO Strategic Toolkit for Assessing Risks, with all 6 regions represented. The distinguished speakers today will be Dr. Stella Chagong, Director of Health Security Preparedness Department at WHO HQ. We'll have Dr. Kingsley Bie, Disaster Risk Management and Resilience Unit at WHO HQ. We'll have Mrs. Jenty Kirschwood, Head of Global Risk Analysis and Reporting at the United Nations Office for Disaster Risk Reduction. Next, we will have Ms. Rowena Capistrano, Technical Coordinator, Health Security and One Health at WHO Country Office of Philippines. We will have Dr. Mahendra Arnold, Deputy Director General, Public Health Services at the Ministry of Health of Sri Lanka, followed by Dr. Nasir Ali Ahmed Mohammed, of Whole of Syria Health Cluster Coordinator. We'll also have Dr. Sapumal Dhanapala, Emergency Risk Management at WHO Country Office of Sri Lanka, followed by Mr. Vyacheslav Kutu, Deputy Director at the National Agency for Public Health at the Republic of Moldova. Next, we'll have Dr. Dick Chamla, Program Area Manager of Emergency Preparedness at WHO AFRO. And we'll have Dr. Alex Camacho Vascones, Disaster Risk Reduction, Unit Chief Acting, Health Emergencies Department at WHO PAHO AMRO. And finally, we'll have Dr. Kutsia Huda, Unit Head of Disaster Risk Management and Resilience Unit at WHO HQ. I am Sophia Song, and I will be moderating today's webinar. Before we begin, a couple of items for housekeeping. This webinar is being live streamed on the EPIWIN YouTube channel. The webinar is being recorded, and afterwards, the recording will be available from our website, and the address will appear in the chat. We invite you all to post your name, location, and organization in the chat box. We would love to hear where you're from. Please add any questions you may have to the Q&A box, not in the chat, so we can more easily keep track of them. And now we'll first start with a Slido question to understand you, our audience, a bit better. So Supriya, I'll turn it over to you.
Hello, everyone. We'd love to know your background, a little bit about your background. So please, we have a Slido here. It's slido.com and hashtag 2943954. Please let us know what category describes you best in your work. You can either scan the QR code on your slide or join us at slido.com, hashtag 2943954. Thank you. We're getting responses now. Right. A large number of people from WHO or from the Ministry of Health, some from NGOs, some from academia. And let's have a look. Then some UN partners, civil society organizations. But Ministry of Health, most people, it seems, are from the Ministry of Health or an agency, related agency. Almost a third. See, we have 156 responses. Please continue to update this. I've put the link on the chat. But in the interest of time, I will just stop sharing my screen right now.
Thanks so
Over to you,
much.
Sophia.
Thanks very much, Supriya. It was great to know you, the audience, a little bit better. So now, without further ado, I will hand the floor over to Dr. Stella Chagon for the welcome to this EPIWIN webinar. The floor is yours.
Good morning, good afternoon, good evening, everyone. It is a great pleasure to join you today for this exciting webinar. We'll look at the country's experiences in implementing the Strategic Toolkit for assessing risks, which is commonly known as the STAR. As many of you already know, the STAR offers a comprehensive and easy-to-use toolkit which allows countries to conduct a multi-sectorial and evidence-based assessment of their public health risks from all hazards. As a result of the assessment, we obtain a risk profile which helps to plan and prioritize prevention, preparedness, response, and recovery actions across all levels in the countries. And this includes the national, the subnational, and the local levels. The tool aligns with the Sendai Framework for disaster risk reduction and supports member states in meeting their international health regulations requirements. The risk profile that is developed from the STAR is integrated across different areas of work in countries, and we will hear more about that today. But a few examples that I can give today include triggering early warning and early actions for imminent risks via integration with emergency operations centers, informing the National Action Plans for Health Security, also known as the NAPS, identifying risk-informed gaps at national and subnational levels for further testing with simulation exercises, and supporting safe and resilient health facilities initiatives. Since the inception of the STAR in 2016, WHO has supported 101 countries to conduct 164 strategic risk assessment workshops in all our WHO regions. As a flexible methodology, STAR has been adapted for strategic risk assessment at the national, subnational, district, hospital levels, and also for distinct hazard-focused contexts such as climate change and infectious hazard risk assessments. WHO published the STAR guidance in 2021, and we have rolled out since then a master training course for STAR workshop facilitators at the global, regional, and national levels. With the great success stories and experiences from countries, we are delighted to have speakers from all our 6 regions contextualizing the good practices and lessons learned from conducting STARs in countries. Today, we will also hear from experts working in the field about how the resulting risk profile is informing actions and planning for managing emergencies and disasters in multiple country contexts. I would like to thank our member states' representatives, the ministries of health, our partners and colleagues who have joined us today from different locations around the world, and also our HQ disaster risk reduction colleagues, as well as our regional focal points for organizing this webinar. I really look forward to the exciting discussions, and thank you all.
Thank you very much, Dr. Stella, for the very warm welcome. I will now invite Dr. Kingsley Bie to provide an overview to STAR.
Thank you, Sophia. Maybe I'll just share my screen, or are you sharing? Just a second. So I'm going to just give an overview of STAR, and just to set the stage for the discussions afterwards today. So STAR is a participatory, inclusive, incorporating gender and human rights considerations, multi-sectorial or hazards approach for countries to conduct a strategic assessment of public health risk at national, subnational, and local levels. It helps countries to characterize and describe risk, identify potential health emergencies before they occur, and a valuable tool for resource allocation, helping countries to plan, also prepare policy actions to manage emergencies and disasters more effectively. STAR is developed from the Health Emergency and Disaster Risk Management Framework. The principles and components of the Health EDRM was very instrumental in the development of STAR. The Health EDRM on its own brings all the actions, the health actions from the Sendai Framework for Disaster Risk Reduction, and aligns them with the IHR, the International Health Regulations for implementation in health. As you are aware, Health EDRM is, please can you share from your end? Sorry, I think we're having a problem with the screen.
No
I'll
problem.
stop sharing.
No problem.
So please, next slide. So how is STAR implemented? It's country-driven, it's deployed in an Excel-based toolkit, uses a stepwise approach. You can see the diagram on the right depicting the STAR steps. We know that there's great interdependency between sectors managing emergencies. So STAR brings together multi-sectorial participants from health, disaster management, agriculture, and other agencies in a workshop setting. The participants consolidate available risk and capacity data. I've identified some of them here, examples on the screen, but also reference their expert knowledge to describe and rank risk facing that context. For the steps of STAR, first, the participants will identify the hazards that are most likely to trigger a coordinated response. And for each hazard, they describe the health consequences, the scale and the exposure, describe the likelihood and determine the impacts consisting of severity, vulnerability, coping capacity, and there's a risk ranking that is done as an automated process by the toolkits, summing up all the information that's been gathered earlier, and then participants will draft some key actions for implementation, and these actions after the STAR workshop is integrated into the plans and operations in the context. Next slide, please. So the resulting country risk profile will consist of the health consequences described, geographical areas affected or prone, exposure, impacts, vulnerability, or even risk ranking. All this data that's been collected as a parameter during the exercise was summarized in the risk profile. And you also have the risk matrix, which is a 5x5 plot of the likelihood and impacts. This risk matrix that you can see on the right as an example is very useful for planning by countries. I think some of them later on will dive deeper into how this risk profile is used. But if you can see this example for hazards, risks like conflicts and flood, they have very critical impacts, and they're also almost certain to occur. So countries have to be prepared to be able to respond to these emergencies when they do occur. But they're not just using the information from the risk matrix, they also combine other elements in the risk profile, like the seasonal calendar of risk, which you'll see later. And then the actions that are drafted based on the risk profile and consensus among experts in the room. The risk profile is very flexible. It allows integration of emerging risk information like ENSO that can follow the workshop, or it can also trigger an update of the STAR. Next slide, please. So this is a seasonal risk calendar that's another output of STAR, a component of the risk profile that enables visualization of months of likely risk occurrence on a green to red color scale, with green indicating the month when it's least likely to occur, and the red color scale indicating when you're most likely to experience that risk. In this example, we have, you can see cholera, flood, and dengue occurring about the same period. So if you can, some countries by January, February, they can have some anticipatory actions already in place, knowing full well that by April, May, they are going to face this. So it helps early warning and early actions. It also potentially identifies concurrent emergencies before they occur. Again, this is also a useful example. We know that cholera and dengue could be cascading impacts of flood, but also it can identify simultaneous emergencies that are unrelated. But this again is only showing us risks that have seasonal pattern. We have certain risks like earthquake that may not have a seasonal pattern. So countries will also have to be prepared to respond to such emergencies that may have critical impacts. And with this, also countries can have an integrated approach, because they're able to see the periods they will face emergencies, when they will be in recovery mode, and that can be integrated into their planning processes. Next slide, please. So this is an example of some of the key actions, the actions that are drafted following a STAR exercise. You can see the key message here is that the actions should be clear. It should be derived from the risk assessment process. So the actions here could be addressing the health consequences to minimize the consequences. Will also be critical, that is addressing issues in a particular hotspot area, addressing vulnerabilities, if also the coping capacity. So in a nutshell, is derived from the risk assessment process. And you also have stakeholders for implementation identified during the exercise. And then they will also agree on the timelines for implementation if that is feasible during the exercise. Next slide, please. So where have we conducted STAR? STAR, like Dr. Stella's speech, we have done, STAR has been done in the national context mostly, but countries are also doing a deep dive into the landscape of risk in subnational areas. And we have seen STAR being adapted for specific contexts like climate change assessment in Sweden. That's been done in 2019 and 2023 to trigger some actions for climate in the health sector. We also have infectious hazard assessment that was done in Bangladesh in the context of COVID-19 to see what concurrent emergencies they need to be prepared to respond to. And then Uganda just concluded a city-level STAR to inform urban preparedness. We also have STAR being applied in the context for early actions. Nigeria had a readiness checklist for priority hazard identified during STAR, and that triggered also some anticipatory actions for this risk. Armenia is integrating it into their public health emergency operational center actions. And this example from United Republic of Tanzania is that after the STAR, it triggered some readiness activities, including training of rapid response team, repositioning supplies, enhanced coordination structures in hotspot areas. And this was key, crucial to the country's response to the Marburg outbreak in 2023. We are also seeing STAR being used for capacity development plus processes like National Action Plan on Health Security in Georgia and other countries as well. Also for multi-hazard response planning in Yemen, Kenya, and contingency planning as well. Next slide, please. So when it is recommended to review and update like STAR every 2 to 3 years, or following any significant change in the parameters that we have described previously, or when there's an external attribute with the potential to impact health risk like ENSO or climate change, or during any major emergency response during a pandemic, like we saw Bangladesh did infectious hazard STAR in the middle of COVID-19. And then we could also do STAR following sudden displacement of a population, but also the country can decide when they want to do STAR. We've seen one particular country that does STAR every year to inform their planning processes. I will stop here. Thank you all for listening, and back to Sophia. Over.
Thank you, Dr. Kingsley, for a very informative overview. We'll have 2 technical sessions today. Let me now welcome Mrs. Jenty Kirschwood, Head of Global Analysis and Reporting at the United Nations Office for Disaster Risk Reduction, to chair the first session. Jenty, the floor is yours.
Thank you very much, Sophia, and thank you very, very much for the invitation to be here with you today. I think it's really a very exciting session, and it's very heartening to see these core principles of the Sendai Framework for Disaster Risk Reduction that really places risk understanding at the core, being taken up so effectively with some of the tools that Dr. Kingsley presented earlier. And I really thank Stella and other colleagues today for the opportunity to chair this particular dialogue. And I look forward to engaging and learning from you all, because I think that engagement of the health sector is clearly key in being able to effectively reduce disaster risk in a sustainable way. And it's clear that these sorts of tools for risk assessment can play a key role. What I'd like to do now is to head right into the presentations. I think we have some rich material to digest today. And if I may, I'd like to hand over the floor immediately to Ms. Rowena Capistrano, who is the Technical Coordinator for Health Security and One Health at the WHO Country Office in the Philippines, who's going to share with us just over the next 5 to 7 minutes some of her reflections on conducting strategic risk assessments in subnational and urban contexts. Ms. Capistrano, the floor is yours. Thank you.
Thank you very much, Jenty. And can I have my slide, please?
One moment, they're coming right up.
Thank you, Sophia. Hello, everyone. So I'm from Manila, Philippines, and I will share with you our experience on using STAR at subnational levels. Next slide, please. So the first, we received requests now from the subnational levels of the Department of Health on conducting STAR, an example of which is on the right side of the slide. The objectives of the request is to capacitate technical staff on identification of hazards and scenarios that requires the activation of subnational response. Also to assess likelihood of the risks, occurrence, and be able to estimate impact of the risk in their areas that would warrant a robust health emergency risk assessment for preparedness and response planning, including pandemic plan. The Western Pacific Regional Office STAR focal point was able to support us in these activities. Next slide, please. So the first STARs of national level in the country was done in Metro Manila, composed of 16 cities and 1 municipality. That includes the capital city, which is Manila City. It is governed by the Metro Manila Development Authority, and it is the economic and political center of the country and inhabited by almost 15 million people. Participants were from the different sectors, including the subnational offices of the government, such as the Department of Education, Bureau of Fire, Department of Interior and Local Government, Reference Hospital and Laboratory. There are also Health Point of Entry Authority and private sector from medical societies and partners. They were divided into four groups based on geographical proximity to each other, and another group for all other government agencies and partners. So we had a total of 5 groups of about 11 to 13 participants for each group. Next slide, please. So for Metro Manila STAR, this is the 5x5 table matrix that is automatically produced by the Excel format collection data tool. There were 14 hazards agreed upon after consensus building, which was done in a plenary manner. All the groups had identified flooding, and it was also agreed that the impacts of flooding in different cities varies from minor to severe, depending on geographic topology and volume of rain in the city and typhoon category. Tuberculosis was placed by the body due to lack of medicines and human resources for contact tracing. Likelihood of novel disease or disease X was identified as 70% to 80% of international travelers passes the airport located in Metro Manila. Next slide. So this is the seasonality calendar, which is also automatically regenerated by the STAR tool that showed what months does specific hazards occurs, and the group provided action plans recommended for each hazard. Example is fire, no? With a very high risk level, where their data shows that during the months of March to May, fire incidences is very high, especially in densely populated communities. And the listed actions are strict implementation of fire code through inspection and more fire prevention campaigns before the months of March to May, and zoning of evacuation centers and referral facilities to mitigate the impact of fire incidences. Next slide. The second subnational STAR is in the Bangsamoro Autonomous Region of Muslim Mindanao, or BARM. BARM is in the southernmost part of the country, where it's an island, where its island provinces are very near Malaysia and Indonesia. It is also the only autonomous subnational level in the Philippines in terms of political authority. The region is culturally diverse, with 13 Moro tribes and 5 non-Moro indigenous people tribes. The region has its share of armed conflicts in all of its 5 provinces, where one of the most intense was in May to October 2017, which is called the Marawi Siege, where more than 1,000 individuals were reported killed. Historically, the region is not affected by typhoons, but for the past 3 years, there is increased reports of weather-related hazards. The participants were divided into 5 groups, with provinces and cities that are in same geographical location. STAR workshops were done in 2 rounds. The first was on biological hazards in July 2024, and the second was on natural and societal hazards in September 2024. Next slide, please. This table shows some examples of actions for dengue and foodborne diseases based on the seasonality of occurrence. Additionally, for dengue, the lack of entomological data was considered in formulating the actions. To provide context on the listed priority action number, that's the number 2, 5S stands for the following. The first is search and destroy mosquito breeding sites. Second is self-protection. Third is seek early consultation. Fourth is supporting fogging, spraying in hotspots area. And 5 is to stay hydrated as part of the case management. Also, the groups had identified areas that are prone to flooding and that experience foodborne outbreaks after. Next slide, please. The participants reconvened for the second round to assess natural and societal hazards. The hazard matrix assessed from the different groups had identified flooding, fire, storm surge, landslide, drought, and conflict in at least one sub-area. For both rounds, the agreed next steps are assigning the emerging and re-emerging infectious diseases and foodborne and waterborne disease program coordinators to consolidate all outputs and finalize and to be shared to the infectious disease cluster and the health emergency management service for inclusion to the plans being developed. As there are significant number of actions for rabies, risk analysis with the MOH or Minister of Health Rabies Program manager for review is also necessary. It was also agreed that province level STAR shall be done in 2025 by the Minister of Health BARM. Next slide. On follow-up, the outputs of STAR in BARM is being used in the current development of their disaster risk reduction and management for health plan for 2025 to 2027. And on the national level, both STAR activities are included in the best practices of the country's self-assessment report for the upcoming IHR Joint External Evaluation scheduled on the 24th to 29th of November this year. Next slide. This is my last slide. So in behalf of our country representative, Dr. Rui Pauli de Jesus, and our team lead in the WHO team, Dr. Yui Seketani, thank you everyone for listening.
Thank you so much. Thank you so much, Ms. Capistrano, for I think what was really a very concise but incredibly rich presentation about how you've been able to really apply this tool so effectively at the sub-regional level and increasingly in urban contexts in the Philippines. And I liked very much the clear recognition of identifying what are those key hazards, identifying, what are some of the key exposures you might be facing in terms of particular disaster, particular health impacts, whether it's dengue, rabies, or other factors, and then also looking at who may be most vulnerable and how they can better access the kinds of services they may need. And again, that continual challenge of data availability, but also that clear action of identifying clear roles and responsibilities and making the best of what you've got. So very exciting, and I think really a very useful and practical example of the tools in action. If I may, I'd like to now pivot us to Sri Lanka and to invite Dr. Mahendra Arnold, who is the Deputy Director General of the Public Health Service at the Ministry of Health in Sri Lanka, to share a bit of his experiences in using the country risk profile to inform capacity development planning in his context. Thank you very much. Dr. Arnold, the floor is yours.
Thank you. Hello, everyone. I would like to thank the opportunity given to present Sri Lankan experience in using the country risk profile developed through the STAR to inform development of a national action plan for health security. Next slide, please. Sri Lanka adopted evidence-based approach in developing NAPs and also conducted country risk profiling workshop prior to next development to ensure risk-based approach in health security planning. Next slide, please. As you can see, several assessments which included National Bridging Workshop, STAR Workshop, previous assessment, and joint external evaluation, which altogether generated 226 recommendations were carried out prior to the NAPS. Next slide, please. The multi-sectoral whole of system involvement was ensured for STAR, where all relevant stakeholders from range of ministries participated. Review of available data and information relevant to risk profiling was done and utilized along with discussions, group work, and consensus building at STAR workshop to finalize the risk profile. Next slide, please. Through a systematic approach, countries' risk profiling was conducted and key action recommendations were drafted based on the risk profile. These key actions were integrated into appropriate plans and operations, including NAPS development. Next slide, please. As outcomes of the STAR workshop, country risk matrix was developed. Based on the risk matrix, national emergency and disaster risk calendar was developed. For identify key hazards, recommended priority actions to mitigate the risks were developed. Next slide, please. The STAR country risk profile was used for emergency preparedness and response planning, including development of the National Action Plan for Health Security. Also, developing the technical area-specific plans, disease-specific plans, and sector-specific plans. Further, it is used for prioritizing of actions and fund allocations. Next slide, please. If you can move to the next slide. Thank you. You can see how risk profile is linked to the NAPS from this table through few examples from CBRN and natural disaster risk. If we take natural disasters like floods and landslides, which are common in Sri Lanka, STAR recommended to develop risk communication and community engagement strategic plans, while through joint external evaluation, the recommendation requirement is further identified in detail as review and adapt existing structures and processes to integrate RCCE and infodemic management into provincial, district, and divisional annual action plans. This recommendation was incorporated as an NAPS action. Let's take dengue, which is a common risk in Sri Lanka. STAR recommended to strengthen relevant legislation, while joint external evaluation identified current capacity level under legal instruments and recommended to conduct legal mapping and strengthening all hazards. NAPS will articulate these recommendations and prioritize conducting a legal mapping and analysis. Next slide, please. Next slide. Yeah. You can see similar approaches was adapted for chemical and radiological hazards as illustrated in this table. We reviewed each proposed operational actions in terms of relevance to risk level during NAPS workshop through eNAPS platform and prioritize accordingly. Our risk profile is well utilized, and we recommend it as an important exercise prior to updating or developing health security plans to ensure risk-based approach in planning. This brings presentation, and thank you for your kind attention. Thank you.
Thank you so much, Dr. Arnold. I think you've really provided us with a very rich experience of how Sri Lanka has been able to effectively plan and really begin to get ahead of the risk curve in the planning phase so that you can prevent some of the potential impacts of disasters on health systems. And I think this is really very, very exciting work, and also very exciting to see how this has been linking not only to traditional hydrometeorological hazards, but also looking at a wider spectrum of hazards, for example, chemical and other risks. So I think that there's a lot to learn, and a lot to learn also about making those plans be clearly linked to capacity development and to other parts of the health planning process. So thank you so much for your words, and I'm sure there will be questions in the next phase. If I may, I would like, though, to pivot us now to our third and final presentation for this part of the segment before we hand over to questions. And please do feel free to put questions in the box. And this presentation is by Dr. Nasa Ali Ahmed Mohammed, the Whole of Syria Health Cluster Coordinator, and it will focus on using country risk profiles for action and planning in a humanitarian context. So thank you very much. And Dr. Mohammed, the floor is yours.
Thank you so much, Ginti, and greeting to everyone. And it's a pleasure to join this webinar that shed the light on a very important issue on how to utilize the most resourceful that WHO has in planning for preparedness and response in a humanitarian and fragile context. I'm pleased to share this experience from whole of Syria, where we use the strategic tool for assessing risk in some of the actions that I will go through in the presentation. But I would like to give us some kind of context for the Syria, for those who have little information and knowledge about the the context of the emergency and crisis. If you see the next slide, that can tell the whole story about what is the impact of 13 years of conflict in Syria and what is the major contributing and driving factors that we're talking about. We're talking about emerging and re-emerging diseases, outbreaks, displacement, economic, socio-economic deterioration, casualties, and the most recently the earthquake, the other also the socio-economic inflation and those economic related factors. And most recently, because of the attention that evolving in the region, the influx that we have seen coming from Lebanon to Syria, that added another element of the country. What does it mean, that context, in terms of number of people in need? If we see the next slide, please. In terms of people in need, you can see here over the last years that we could see that people in need are increasing while the driving factors continue. And the same time, we have the funding is going down, and that actually hampering the capacity of health sector, including cluster-led agency, including also the health partner across the different part of the country, as I will show in the coming slides. Is just to give an idea about how this can really affect the overall vulnerability and also the coping, the capacity and the coping mechanism of the community itself. If we go to the next slide, please, we will see if that is the situation, if this is the contributing driving factors, then we can see what is the capacity, the health system capacity right now. If you go to the next slide, please. That slide can give us an idea about what exactly the health system capacity that we have. It's enough to understand from this graph that almost 40% of the health facility, primary health care and hospitals are either partially functional or non-functional. And that's really like a devastated situation where we're trying to, in one hand, meeting the people needs, and in the other hand, trying to maintain the functionality of health system that include not only the functionality, but other aspects of the health system component. If you go to the next slide, please. So in terms of coordination, that's another element of the impact of the crisis, where we have now a country and actually divided and fragmented in the governance. We have the government of Syria controlled area, then we have the cross-border into the northern part of the Syria. And you can see, for example, what is the capacity that we have in terms of coordination team, in terms of also the partner presence in each of those response areas. And I think WHO as a country office and also the field office in Gaziantep, the health partner, are doing their best with the donor to maintain or to meet the people need, giving that fragmented governance and also the institutional capacity as well. If we go to the next slide, please. That gave us an idea about what's the rationale and how did we, as a whole of Syria health sector, as a WHO, as a cluster agency, how happened that we come to use the STAR to actually use it in further planning? First of all, that there is always a recurrent and complex disaster affecting health sector capacity operation. Then we have a lack of priority risk and hazard at whole of Syria. Yes, the country office and the field office, they do themselves, they do their best to have a public health situation analysis. They have already this national action plan for health security, but we never had some kind of a whole of Syria that can give us a full picture of the situation. And this is exactly why we need to use the STAR. And we have 2 rounds of the assessment. One was in 2022, and the last one was actually late last year. And the next slide will give us an idea about the involvement, how the process went in the STAR analysis. Involvement, we have involved across the 3 response area, not only the health coordination capacity team, but also the WHO technical team, and many thanks to the regional office of the Eastern Mediterranean region for the kind and tireless support they have given through all the process. And we have also involved the whole of Syria, other sectors, nutrition, wash, and that's how it makes it more value to work with other sectors as well. Because it was very difficult for us to bring everyone in one room because of this fragmentation, political sensitivities, and so on. We rely on the online and virtual meetings, workshops, where we have managed with the WHO EMRO team to have a couple of sessions online. Then the review, we had a follow-up discussion with bilaterally. Then we have, of course, another same discussion with the cluster-led agency. And before we get the clearance from the country office and the WHO as a country office and the country level cluster-led agency. How did we use that? We use it in a 2 different ways. It was informed the development of the whole of Syria, what do you call it, multi-hazard preparedness plan that is actually being drafted and being reviewed and well. And it was very helpful in drafting the whole of Syria sector of nutrition, wash, and food security engagement, but also it helped in the other area and was for the diseases prioritization exercise that has happened in 2 different hubs and 2 different response areas. Next slide, please. If you can see here, it can give you an idea about how many hazards had been identified using the tool in 2 rounds of the assessment in 2022 and 2023. I'm not going into details, but you can see, for example, in the next slide, please, what are the most critical and the identified risk that has been identified under the very high risk and high risk itself. Next slide, please. That's the results that we have on hand at ultimately, where we have identified many potential hazards under the very high risk and also moderate. That actually was the base to have our whole of Syria multi-hazard preparedness and response plan. And the next step should be at hub level. We need to have a specific hazard readiness and response plan as well. I think that's the end of my presentation. I would like to thank everyone for the attention and listening, and back to you, Genti. Thank you.
Thank you so much, Dr. Mohammed. I think you have provided us with a very useful and also sobering profile of just some of the challenges that you have been facing in that whole of Syria approach, but also how you've been able to use this tool to create dialogue across different geographies and different situations, and how you've been able to use it to help prioritize in a situation of increasing caseloads and decreasing resources. And it's particularly interesting also to see the way that you've been able to so effectively engage also with other clusters and to create a more common risk approach. So extremely useful, and thank you so much for that. I believe, colleagues, that we are slightly over time, but if I may, I would like to just perhaps allow a couple of questions. I can see some quite rich questions in the chat. Brian, I don't know if you want to come in with a particular question or if I should pick one myself. Go ahead.
Hi, Genti. So yeah, there's been a couple of questions, I think 10 that have been answered so far. There was one which Dr. Kingsley B had answered, just a short one as to which country are these risk occurrence applied to seasonally. And so Dr. Kingsley B, if you want to unmute yourself and maybe you can answer that one.
Yeah, thanks. So a quick answer. I think this question might require more elaboration, but from what I gather is what I can respond now is that any country doing a strategic risk assessment using STAR can have a seasonal calendar of risk at the level where they are doing the STAR assessment, whether it's at the national level, then they can have a national calendar, seasonal calendar. If they are doing at the subnational level, they can also have a seasonal calendar that is at the subnational level. So it's actually context specific. Most of our exercises are done at the national level. So if that question, if they have a follow-up, we can also respond to it. Thank you. Over.
Thank you. Thank you so much for that, Dr. Kingsley. And I realize that in the interest of time, we're not going to have time to go through all of those questions, but we will try, I believe, some of the speakers, we will try to get their responses to you in the chat during the rest of the meeting and or subsequently. And I very much appreciate some of the feedback and thoughts on how do you maintain these tools, what's really specific about them, how can we make sure that they're most effectively applied in various contexts. So I think this may be very much the start rather than the end of a rich conversation. So I'd like to now conclude this session just by thanking all of the speakers again, I think, for excellent and very timely and rich presentations, and to congratulate the colleagues from around the world in some of their implementation success and applying the tool, and to wish you all the best in the future and hope that we can continue to collaborate to effectively reduce risk and the burdens on health systems that occur from disasters. Thank you very much. Back over to you, Sophia.
Thank you, Genti, so much for chairing the session and keeping us on time. And thank you very much to the great speakers sharing your insightful experiences from the Philippines, Sri Lanka, and Syria. So before we move on to our session number 2, we like to hear from you, our audience, again. So we will be launching a second Slido question. So Lester, I will hand it over to you.
Thank you very much, Sophia, and it was great to hear the discussions and presentations earlier. So we invite you to participate again for this second Slido questions. Have you ever been involved in a STAR exercise? So open to slido.com, hashtag 2943954. We can wait for a few seconds for colleagues to answer. So as mentioned earlier, STAR has been implemented in so many countries, including subnational level. And most colleagues have there are many questions of interest. And while many colleagues have participated in STAR, we see about 1/4, 25%, who have actually joined STAR exercise. So thank you very much. And you can keep on answering in this Slido question, slido.com. We will share again the number. And now back to you, Sophia.
Thanks, Lester. So now let me invite Dr. Sapumo Dhanapala, Emergency Risk Management at WHO Country Office of Sri Lanka, to chair our second technical session. Dr. Dhanapala, the floor is yours.
Thank you, Sophia, for the introduction. And once again, welcome to all the colleagues and participants for this interesting webinar. And I'm sure all of you would have learned a lot from this session 1 of the experiences from Philippines, Syria, and of course, from my country, Sri Lanka. Without taking much ado, I think we need to make maximum effort to keep our audience interested on the next 3 presentations, which are going to be even more exciting or equally exciting. And I would like to invite the first speaker, who is Mr. Gutu, who is the Deputy Director from the National Agency for Public Health, Moldova. Mr. Gutu, could you tell us the experience of how Republic of Moldova applied the STAR at the subnational level, so that our audience can get a better understanding from your experience in how you all did it in Moldova. Over to you, Mr. Gutu.
Thank you very much for this opportunity. First of all, I will ask the colleagues to share my presentation and to start to share the Moldova experience. So Moldova, next slide, let's start. Moldova is a small country in the region of Europe, and also it's, let's say, has some hazards, next slide, if it's possible, because... So Moldova, small country in Europe, which face with multiple risks, like biological, like chemical, like terrestrial, and also involving challenges like the COVID-19 pandemic and the war in Ukraine, because the Moldova is nearby Ukraine. Conducting regular risk assessment is critical for identifying and addressing these threats. Next slide, please. As a history, Moldova, it's, let's say, done for the first of all, the risk assessment in 2018. And those risks, let's say, found in those moments today are not already in place. Let's say the landscape has since changed until today. So we decided in 2024, in according to government prioritization, to update our risk profile due to new threats like pandemic and regional instability. So the leading of this STAR was the Ministry of Health with the WHO support to conduct the risk. So the process has the main task to improve intersectoral collaboration among key stakeholders and resulted in update more accurate list of current hazards. Next slide, please. If you are talking about let's say the process of the step by step how it was organized, I want to mention three main aspects. The first of all, it's the government of the Republic of Moldova, how was mentioned previously, prioritized this task in one of the decision which was implemented in 2023 and help, let's say, the country, the Ministry of Health, the National Agency of Public Health, which is the focal point, to start the providing this exercise in Moldova. The second is that the country has a big support from the WHO and use the tools for this experience. And the third, let's say, is the support from all sector which was involved in the evaluation. I mean, the other partners, other Ministry of Representative, other agency, and other sectors. So the first meeting was done in June this year, 2024, and Moldova also, in according to the recommendation of the national workshop, was providing also the territorial level risk assessment in September. Next slide, please. So you can see this is the list of the main participants, starting with the Ministry of Health, who lead the evaluation, let's say the STAR, the workshop, and finally with the Naval Agency. Also, we had the colleagues from the laboratory, from the university or academia, from the borders, from the customs service, and so on. Let's say it was a big team involved in providing this important workshop or exercise for the country. Next slide, please. You can see the results. We have results in all, let's say, profile. In according to the risk profile, in according to risk level, also we have a lot of risk determined in according to risk calendar. Also, you can see because most of them have seasonality, most of them doesn't have seasonality, and this kind of the categorization help us to improve our future plans and activities. Next slide, please. In according to the assessment done in Moldova and how this risk evaluation will help us, first of all, the update risk profile helps tailor public health emergency response plan, ensuring a focus on high priority threats. Also help us to inform the national public health development, because it's the main institution which leads the development of the public health response plan. Also will help us to have a good resource allocation in this regards, and also a dynamic response, like flexible response frameworks, which can be based on evolving risk, enabling swift adaptation. Next slide, please. In according to the challenges, of course, I want to mention some keywords related to the intersectoral cooperation, because we had all key partners together, but taking the consideration that Moldova it's in the process of digitalization, some data are not in real time, and most of the partners mention this kind of aspects. Lack of plans with distributed responsibility also was one of the challenges. Very low risk management capacity, limited financial resource for equipment, insurance, and need of participating in the planning, designing, and conducting exercise to assess preparedness and response to public health hazards. Next slide, please. Lessons learned and best practices, and also a recommendation which was, let's say, found during the providing exercise, elaboration and updating of plans for preparation and response to existing public health hazards and emergency at the national, regional, and territorial level, with the involvement of all actors responsible for responding to public health hazards and emergency in public health, developing contingency plan for risks that have been assessed as requiring additional risk mitigation action. Also, colleagues mentioned about the trainings with some period and periodically carrying out the assessment of public health hazards and risk with the updating of risk list for public health hazards. And the next slide is the team which was involved in the STAR providing in Moldova. Thank you very much.
Thank you, Mr. Gutu, for keeping the time and, of course, for the excellent presentation. More important is sharing with the countries and the colleagues about the challenges that you faced and, of course, the best practices and the way forward. I'm sure our listeners will have many questions, and if you do have questions, please put it in the Q&A box so that our facilitators can then start answering. So thank you very much for that excellent presentation from Moldova. Next is an equally exciting presentation. This is from the African region. Dr. Dick, who's the program area manager, will share with us how they have applied the country's risk assessments in having early warning and early action in the African region. Without much ado, Dr. Dick Chamla, over to you.
Hi, everybody. Do you hear me now?
Loud and clear.
Okay, perfect. Okay, esteemed colleague.
Can we have your camera on, please, Dr. Dick, if it's okay?
Okay, you got it. Okay. Okay, so do you have my presentation on there?
Can we have full screen, please?
Yes, okay. Okay, esteemed colleagues, ladies and gentlemen, as introduced here earlier, my name is Dr. Dick Chamla, and I'm a program area manager for emergency preparedness in WHO Africa region. And almost 2 years ago, our ministers of health in Africa region adopted the regional health emergency strategy. And one of the priorities of the strategy was to harness the power of innovations in predicting future risks and hazards. So in this presentation, I'll be talking on how the WHO Afro region was able to transform a strategic toolkit for assessing risk STAR from the analog, how it is now, to the digital platform. So prior to explain our innovative project, as I'm talking now, we have over 150 public health events in which are present in the region of Africa. And it includes outbreaks, the conflicts, as well as the climate-related disasters. So at the time we were talking about transformations of the STAR tool, we are really talking about 3 interrelated projects. The project 1 is about how to transform strategic toolkit for assessing risk into interactive STAR dashboard and the regional risk calendar. And the other project is AI-driven automated hazard alerts. And the last project is AI-driven predictive modeling of public health event cases and death. So at the end of my presentation, I'll play a clip in which it will have a demonstration of the project. Therefore, here I will only show how a transformation looks like at the moment. So on the left hand is a STAR dashboard in which now we are able to bring on all the country STAR into an interactive dashboard in which it has a number of areas here in which we see, either from the main, it will tell us the number of countries in which have conducted STARs and which one haven't, the number actually of hazards or proportion of hazards in which the highest risks, etc. On the right hand is actually a regional risk calendar in which we've added actually an actual calendar interface in which it enables us to also understand what other actual issues or events occurring, and it will enable us to advise our countries. On a project 2 in which we're talking about automated hazard alerts, here is how we've done is to really to take information from STAR and having an AI algorithm, plus creating a threshold and triggers in which it's able to create hazard emails, alerts, actually to all our member states 2 months in advance. And from here, we have the languages in English, French, and the Portuguese, in which we tell the country, example, in October, so we are able to tell the country you have higher risk of the cholera in December. And the email also have an attachment in which in this attachment we have actually added information on the actions required to mitigate the risks. And the last project is AI-driven predictive modeling, in which we were able to have a pilot on the cholera cases. And here we took AI algorithm plus a statistical package, including time series analysis, and also included a climate weather data from actually an NASA database in which it was enabling us to see a fluctuation of weather and also see actually what is the likelihood of occurrence of the cholera case. So we've already piloted it actually in the DRC and the Mozambique, and we've had a predictive and accuracy rate of actually over 90%. And what are the next steps? The next steps here, we are likely 3 weeks ago, we have had this an agreement with Harvard and MIT colleagues in collaboration with this predictive modeling project, in which we have expectation we start his collaboration next month. And another action in which we are planning is actually to transfer our interactive dashboard and the risky calendar and predictive actually modeling in a mobile app. And the last thing in which we have started actually talking with our readiness colleague is to see how are we able to create the linkages with the readiness intelligence tool, in which it is been already piloted in few countries in Africa, as in Nigeria. Okay, I will end up here, and I will now play a clip in which it will actually briefly, only 2 minutes clip, in which it will show you how this STAR is actually play. Okay. I hope slide and it's clear there.
Welcome to WHOA-FRO, the Calendar Alert Project, and the Cholera Prediction Project. The Calendar Alert Project is designed to enhance the understanding of global risk events through a user-friendly calendar interface. This Power BI dashboard was designed to monitor and respond to health emergencies across Africa. Central to this project is an interactive bubble chart that visually represents the frequency and distribution of hazards across countries, accessible by hovering the cursor over specific bubbles. On the left of this tool, you'll see a detailed map highlighting the distribution of different hazards across the continent. Each colorful segment represents a specific type of hazard, including air pollution, anthrax, avian influenza, bushfires, cholera, and COVID-19, among others. As you can see on the calendar for August, we will have the Regional Committee. The map allows you to see the high hazards in Congo and neighboring countries, allowing one to better prepare in advance. On the right side of the interface, users can stay informed about upcoming events and conferences related to risk preparedness. Additionally, The left-hand menu allows for detailed analysis by filtering hazards by country and month, providing localized insights to aid in decision-making and risk mitigation. In our second project, that is the Cholera Prediction Project, it leverages advanced AI and machine learning models to forecast future cholera cases, deaths, rainfall, and other key parameters influencing the spread of the disease. In this Cholera Prediction Project, by analyzing historical data, we can estimate future trends and identify specific months when cholera cases and deaths are likely to rise. Because of this automation, we got 91% accuracy in our predictions, and death ratios got reduced. This tool aids in emergency preparedness and response by providing a comprehensive overview of various risks across Africa. These two projects are not just about awareness, but it's about empowering us to take action. The WHOAFRO proactive approach allows for better preparedness and targeted interventions, potentially preventing outbreaks in affected countries before they occur. These two tools are essential for anyone involved in disaster preparedness and response in the African region. Thank you for using the WHO Afro Emergency Preparedness and Response Regional Risk Calendar. Stay informed, stay prepared, and together we can enhance disaster preparedness across the African region. For further information, contact Emergency Preparedness EMP Program EPR Cluster WHO Afro Region.
Okay, it's all from me.
Thank you, Dr. Chamla. Very interactive and interesting actions. And I'd like to thank the Afro Regional Office for using STAR in actually using for prediction models. I'm sure AI tools which have been used here and the examples that you used and the software can be shared with our rest of the regions as well. And I'm sure these innovations that you have started would go from strength to strength to improve the preparedness and response. And of course, it's nice to see that modeling and predictions also have been tried out using this tool. So once again, congratulations, and hope to see more innovations in the next few months to come. The next presentation is quite exciting on something that I have heard but never actually had the experience of listening to. And this is from Dr. Alex, who's the Chief of the Disaster Risk Reduction Unit of the Health Emergency Department in PAHO. And his main area, can I invite you to tell your experience in how PAHO used the STAR tool for hospitals to make hospitals resilient in PAHO. Over to you, Dr. Alex.
Thank you. Thank you so much, and congratulations to the previous speakers for their great presentations. And I want to recognize and to thank to Stella, Kutsia, Kingsley, and all the team that has been working on this. And I'm really, really happy and excited to see how STAR has progressed in the past almost 8-9 years that we have been using. I was part of the development team in 2016, 2017 with Kutsi and others, and I'm really happy to see how this has evolved. And now, I'm usually based in Washington, D.C., but now I'm sending you greetings from Ecuador. It's early morning here, and I'll share you one of the key elements of our Resilient Hospital Initiative to Health Emergencies and Disaster. It is a STAR 8 that is something that really has evolved from the original STAR. Trying to go to the next. Okay, so STAR H, this is how we called. It is available now in 4 languages, the 4 PAHO languages: Spanish, English, Portuguese, and French. We are collaborating with some regions that have been showed interest in translating or using, adapting, improving the tool. So why hospital resilience is especially important for the Americas region, and why risk assessment is the key of this? First of all, because the target D, especially target D2 with the 7, call us to act to reduce the number of destroyed, damaged facilities, and to reduce the number of health services attributed to disasters. Of course, you know everything about the global frameworks. I'm not going to stop here, but to highlight the also international health regulations in terms of health services provision is a key. This is one of the main components to guarantee the continuity of health services during pandemics, epidemics, among other hazards. We know what happened during the pandemic, the disruption of health services, and the Americas was also very complex situation. Over 50% of health services were interrupted. And I want to highlight this research that we carried out in terms of hospital exposure to natural hazards in the Americas. 40%, over 40% of hospitals in the Americas have a high level of exposure to 5 natural original hazards that are earthquakes, landslides, flooding, volcanic eruptions, and hurricanes. So it means over 8,000 hospitals that we have to prioritize. And one of the key messages of the STAR age is prioritizing. That is one of the, I will say, the failures on implementing everything that is related to the safety, sustainability, inclusivity in terms of health services. Also, we're conducting a research that we have some preliminary results on what will be the affectation of sea level rise. This will impact severely our seeds. It is something that we have started working as well, and we want to progress on that. But what to impact, really? And essentially, with the resilient hospital approach, where risk assessment is a cornerstone, will impact on universal health coverage, guaranteeing the continuity of service, global health security for sure, because we're starting working on pandemic preparedness in hospitals as well, climate change adaptation and mitigation, disaster risk reduction, sustainability, and health inequity. What are the attributes of a resilient hospital model? Is that is smart, so it means safe and green, inclusive, agile, and continuous learning, with some other aspects that I'll be more than happy to share in the future. So we have been using this since 2021, several tools that we have been developing. So it can be very easy and friendly user tools that are needed to strengthen hospital resilience. So risk assessment, STAR age, goes hand by hand with the hospital safety index. It cannot go separate. And we have added inclusion, tools for inclusion, incident command system, SORT age, evacuation, smart hospitals and team of green hospitals, rapid assessment, among others, but also including some other aspects that infection prevention and control, simulation exercises, and some other. So this is how the STAR age dashboard looks like. After the assessment, you will have a very comprehensive showcase, a report where the hazards, the number of hazards assessed, and if those are in a very high level to very low level. I will say that STAR age is very similar to STAR. The main difference on this is by assessing the impact. By assessing the impact, we analyze 3 aspects that are key for the continuity of services. What are those aspects that can put in risk the life of the people, that can affect the continuity of services, and of course the building, a structural part, non-structural aspects, and of course the function, the continuity. So these 3 aspects are, we'll say, the main difference from the STAR original tool by assessing the severity in the impact. After that, I will say it has the main aspects that make even more easy for the users that have been utilizing STAR in the regions to approach on this. So this is the hospital safety index. We have improved very much the reports, and also to prioritize what are the key aspects that we have to address. So risk assessment and hospital safety. You know, the module 1 in hospital safety index is not practical for use. It doesn't give you what are the priority risks. It doesn't give you a key information how to prioritize maybe the 151 items that you have in the hospital safety index. Or doesn't help you if you run some other assessments that like hospital readiness checklist or some others like for pandemic preparedness and so on. So what it helps you is to prioritize risk scenarios. And so what will be the interventions depending on what you have found, for example, in hospital safety index, depending on the prioritized risk. So here it comes the question, what to do first, STAR H or hospital safety index? I will say that both should be done in parallel. However, the reality, for example, in the region of the Americas is that many hospitals have assessed hospital safety index. But I will say the sad part is not many of them have intervened in the specific aspects that were needed. So with the STAR H, including the STAR H, you have already, of course, the vulnerability assessment, and you have a lot of information in terms of capacities. However, it is necessary to provide some information to the manager, to the hospital manager, to decide where to start. If you managers that are listening to me knows how problematic is managing a hospital, you know that you have 1,000 priorities, 1,000 problems. And it comes the team with the assessment on safe hospitals and epidemic preparedness, and so say, okay, where do we start? That's what STAR H resolves. So in the implementation of the initiative, as you see in the phase 1, STAR H is yes or yes to do. We have been asked to use hospital safety index, for example, for small facilities. And I'll always tell them, do you want to assess your 3,000 health facilities? Are you sure? Are you going to intervene in those 3,000 health facilities? No, I don't have the money. So use the STAR H. You can do it even if you utilize the right methodology. We can even do it online, and you can provide at least some prioritizations of the hospitals where you are gonna go to intervene in a more specific way. So we have had several experiences in Costa Rica, Guatemala, Nicaragua, where they wanted to assess all the hospitals. They started with STAR H, and at the end, they prioritizes those that are in a high risk depending on the situations. And of course, they have prioritized the interventions, not necessarily safety hospital index or among other tools. And then everything else is the result of the STAR, as we do in health emergency disaster risk management. So I'm sorry if I went over the time. I'll be more than happy to respond any questions. If you want some information, here you have my email. I'll be more than happy to support you. Thank you so much, and congratulations again to all the team that is working on the STAR. And please do not make changes. It has been using for the region. It's working perfectly. Thank you so much.
Thank you, Dr. Alex. We could see the passion in the entire project that you are involved in the STAR H, and how you prioritize this in the PAHO region. And I'm sure many of our regions can learn from PAHO and have this hospital resilience also using the STAR H in the rest of the regions as well. So, and thank you very much for sharing your experience. And I'm sure all the participants during the webinar would have understood how this STAR can go beyond what we traditionally do and use it for subnational level that we saw in Moldova. We also saw how it can be used in the African region to improve the emergency early warning and early action using AI tools. And of course, the last presentation on how it can be used in the Safe Hospital Initiative or STAR H, so that the hospitals are made more resilient. So thank you very much for all three speakers. And if I can ask Dr. Lester to identify a few questions that we have for the speakers so that they can answer it. Dr. Lester, over to you.
Thank you very much, Dr. Sapumal. I think we have actually very limited time to answer the questions, but let me see. One question has been answered, and maybe colleagues would like to give more information here. There's a question from Ando Raubelison. What recommendations would you provide NGOs for them to get engaged in STAR at subnational level, and what role could they play? So mainly it's about stakeholders, including NGOs. Maybe somebody can would like to reply? Another question. So Dr. Kudsia actually has her hand raised. And we
Yes,
don't
I can step in. I can step in.
Can you turn off
I can step in for this question. How NGOs have been engaged. I think that it's very important that all the stakeholders in the countries they get engaged, and that this is part of the STAR methodology already. That how we can engage other all the stakeholders at the country level. And
There's a stakeholder mapping being done in the very beginning of STAR when the STAR is being communicated, the whole process. So I don't see that there's any problem for that, but it's a responsibility of the in-country STAR coordinator who organizes the workshop and to bring in the NGOs. Dr. Sapomal, you led the STAR in Sri Lanka. I think that you would also be in a very right position to give an example perhaps in this regard. Thank you, and back to you.
Thank you very much, Dr. Huda. Yes, in Sri Lanka, we did invite the NGOs to be part and parcel of the STAR exercise. And I'm sure most of the countries would involve the NGOs and the multi-sector approach in actually approaching this, not only at the national, but at sub-national level, etc. If I may, do we have time? Can I ask a question from Mr. Gutu? Mr. Gutu, can you tell us how you prioritize the sub-national areas for the STAR? I'm sure many national level colleagues would like to know how you prioritized it.
So thank you very much for the questions. Of course, in Moldova, there is around 37 regions, and we prioritize just 10 of them to do the STAR in this regards. So we provide, in according to the national level, of course, we had some representatives from the territorial level, and in according to the national results, the colleagues who mentioned that in some of their region, maybe the results cannot be reflective, and they ask to start to do a risk assessment in the region. And in accord to result, of course, in some regions, the result not the same as to the national level.
Thank you very much. Dr. Lester, are there any other questions, or do we have time, or we have gone beyond time? I'm not sure. I don't know whether we are on track or not on track.
Yeah, maybe we can check one question for Dr. Alex. Difference between STAR-H and Hospital Safety Index, and also objectives in making the hospital more sustainable and resilient. So any of the hospital-related question, and I think we can close after this session. We can give back to Sophia. Thank you.
Thank you, Dr. Alex.
Thank you. Thank you for the question. As I said, STAR-H goes hand by hand with Hospital Safety Index. As you know, the module 1 of Hospital Safety Index is only qualitative information. And usually it's not used for decision making. And it makes very difficult to correlate the results that you have. In fact, you do not correlate the results that you have after the assessment with information in module 1. So what I will say, risk assessment improves that, but also gives the opportunity not only to use Hospital Safety Index and to correlate to that, but to other tools, to other strategies like IPC, pandemic epidemic preparedness in hospitals, and so on. That will be the main aspect. In terms of sustainability, if we do find that there is some vulnerability regarding that is caused by climate change that are correlated to, for example, to extreme events, yeah, it's maybe something that should be addressed. For example, in the small developing islands, it is key to enter with a sustainability approach. And for that, we have the Smart Hospital Toolkit, that is the safe and green component that we have now added in all these concept of this framework of hospital resiliency That is, we have been working closely with MROC especially. And yeah, it gives you also a good starting point, the risk assessment. Risk assessment in a way of planning, that is important to mention. Risk assessment for planning purposes.
Thank you, Alex, for sharing that experience and answering the question. And before I hand over to Sophia, I think I see a lot of champions for STAR in this workshop who are joined, and I'm sure there'll be many more champions who would join this effort after today's webinar. I'd like to thank the organizers for organizing this webinar, which involves all 6 regions and sharing different aspects of this. So for me, I would like to make special mention of our program area manager from CRO, Dr. Ruben, who was the champion for us and who brought in Dr. Sandeep and Dr. Warren Taylor to Sri Lanka to introduce this tool. And now we have many champions in the country. One, of course, who presented today is Dr. Arnold. So I'm sure many countries have such experience. So I do hope that we have many more webinars such as this, so that people can learn from each other. And that's how we should use the tool for purposes of improvement. So thank you for asking me to chair session 2, and all the presenters for keeping to time and for the excellent presentations done. Sophia, it's over to you after the session 2. Thank you very much, everybody.
Thank you very much, Dr. Dhanapala, for chairing, and thank you for all the speakers presenting the examples from Moldova, from Afro, from PAHO. They have been truly impressive examples. And next, I will now invite Dr. Kutsia Huda for closing remarks. Thank you.
Thank you very much, Sophia. Thank you all the speakers and the chairs for such informative webinar, sharing STAR implementation experience in countries across the world. We have heard from experts coming from all 6 WHO regions, including countries, on how STAR is being applied for strategic risk assessment, and how countries are using the risk profile to inform the policy plans and implementation, which is key, actually. That helps us in locating the problem and then also mobilizing the resources based on the evidences. So we also heard that STAR is being adapted to conduct strategic risk assessment in different contexts as well. The humanitarian situation, hospital preparedness, and as well as for climate crisis. We all know that we are living in a very rapidly evolving and interconnected world, where countries are constantly facing complex situations resulting from concurrent emergencies. One of the prime examples is the recent COVID-19 pandemic. When countries are responding to the pandemic, the communities are hit by many, many other emergencies like earthquake, cyclone, flood, and other infectious hazards. That's why STAR is so crucial to help countries in identifying the potential complex concurrent scenarios that helps to trigger early actions by engaging all relevant multi-sectoral actors for better preparedness and response towards saving life and minimize loss and damage. Yet we continue to do better. We have been collecting all the lessons learned, experience, recommendations, suggestions from all over the world, from these 101 workshops being held in countries, and analyze those data. We analyzed and we came to a conclusion that there are ways to make things better. So I would like to ask my colleague to kindly put up the slide where we put together those information in a systematic manner. So while we are celebrating the success of STAR, we worked on the challenges as well. As I said, that we analyzed all the information from the countries. And then we realized that we only have one goal. We need to keep to improve, and then to improve the STAR and also the implementation of STAR. That one goal is to enhance the country support. And then to do that, we categorized all these experiences, and as I say, the challenges into 3 areas of improvement: STAR toolkit, STAR capacity, and STAR governance. Under these 3 headings, we have listed them. As for the toolkit, we have heard that it's often difficult to collect the information, analyze them in a rather broad Excel sheet. So we are actually moving towards developing the E-tool, which is called E-STAR, we anticipate that it's going to be more user-friendly. And then this can easily be linked to the geographical information system risk mapping exercise that others are doing. And then it is also be quite easy to link to the emergency operations centers data. And then this toolkit also will allow us to improve the vulnerability assessment, because it will need a rather broader landscape to feed in the data. And then not to mention that accordingly, the guidance will be updated. So when it comes to the capacity, I would like to refer to the Slido outcome, where it says that it revealed that only 25% people are actually aware of STAR and engaged. But then our target would be to bring in those 75% who are outside this box. So this capacity is very much required. We have heard from all the 6 regional experiences that how important it is to conduct this STAR periodically, how they're more and more every single day, they're expanding the opportunity and scope of STAR. That's why we are emphasizing on developing STAR capacities across the regions in the countries. Then one is by developing a virtual training program, rolling out this facilitators training, and looking in all other opportunities that how we can make this STAR facilitators training and this experience to all the countries and all the stakeholders, including the private sector, and also because one of the questions came out in NGOs. We are also working with our research network and then research community to encourage research around STAR, to develop the community of practice, and at the same time to publish the best experiences and also the challenges and opportunities of STAR. Finally, I would like to raise one thing that around STAR governance. This has become very, very critical. We are planning to come up with a policy brief that how we can ensure few issues and challenges are still around STAR. One is the ownership and access to data. The STAR at this moment is, of course, and in absolutely the owned by the countries, and then their prerogative, countries' prerogative, that who they give the access to the data and how they would like to see it. I would like to take this opportunity to mention one thing. This information are crucial. This information are very, very crucial to generate those evidences for the resource mobilization, for the engagement of the donors and partners as well. So this one discussion I would like to raise here today, and to take it further in the coming days with the countries, and then with the STAR champions and STAR leads across 6 regions of WHO, that how we can do that, what would be the solution, and how can make sure that part of this visibility is given to the wider audience. And you have seen a very good example of AFRO, this risk dashboard. I think that this would be also very crucial for the countries to develop the risk dashboard, while it is important to develop it at the national level, for taking early action, for better preparedness and effective and timely response, at the same time to inform the national policies and strategies at the country level. So with this, I would like to go to the next slide. So you can see that there is a lot of logo. These are all our partners, have been working with us over the last 7 years. And then, by keeping this on the slide, I would also like to mention that what I said in the previous slide is going to be our next leg of our journey, where we would like to have all of you who are on this slide with us, our partners, our academic critics, also to look for what we might have missed, and our champions to push this agenda further with the solutions. Now, I would come to the vote of thanks. It is the time when we conclude and offer our absolute gratitude and thanks to all of you. First, I take a moment to thank all the esteemed speakers from the countries, regions, and headquarters for their insightful deliberations and discussions today. Thanks to Mrs. Jenti Crashwood from UNDRR, who is our long-term alliance, and Dr. Sakumal from Sri Lanka for their excellent and dynamic chairing of the sessions today. Thanks to the leadership of WHO Health Emergency Program for their relentless support and guidance toward this STAR journey. Our profound gratitude to the EPIWIN colleagues for their around-the-clock flawless tech support in organizing this webinar and moderating the session. Sophia, a special thanks to you from the DRR team and all of us. Now, I would like to thanks to all regional, country, star focal points, leads, and my HQ disaster risk management and resilience team today, and who have been working in this team before to pursue and to work in this star and make it where it is today, and without whom we could not have put together this webinar. Finally, my immense appreciation and gratitude to the thousands of audience who are present in the Zoom and also watching on YouTube. Just so you know, your presence truly inspires us, motivate us only to do better in this journey in the coming days. Thank you again, and back to you, Sophia.
Thank you very much, Dr. Kutsia, for your inspiring closing remarks and for sharing with us the future plans of STAR. So as we're coming to the end of our allotted time, I'll wrap up by saying thank you very much to all of our speakers today, the WHO colleagues who have worked on this, and the EPIWIN team. Finally, thank you all for coming and for your questions. The recording of this webinar will be available at the EPIWIN website. An EPIWIN digest, a slide set with key messages on this topic, will be published shortly. If you want to keep updated on future EPIWIN webinars, recordings, and presentations, and EPIWIN digests, please subscribe to our mailing list. Both links will be appearing in the chat. We hope you will join us for our next webinar, which is next Monday, October 21st, on clinical practice guidelines for influenza, new WHO recommendations, and the evidence. Details are posted on the website and sent to the mailing list. Thank you again and goodbye. See you next time.
Thank you. Bye-bye.
Bye-bye.
Thanks. Bye.